So hello, my name is Jamie Wise, Managing Director of Frank Health, and I'm delighted to be here with Sanjay Patel, who's paediatric consultant at Southampton's Children's Hospital and lead of the Healthier Together initiative in Wessex. Sanjay's kindly agreed to this video interview today for Frank Talk to talk through and share his experiences of the recent launch of the Wessex Healthier Together website. So thank you to Sanjay for your time today. So really, what was the driver for the redesign of the website?
Well, we worked with Frank, as you know, a number of years ago when we first developed the Healthier Together project and website. It was about 4 years ago. The aim of our project is to improve the health and well-being of children and young people across Hampshire, Dorset, the Isle of Wight, Southampton and Portsmouth. And the original website was really well received.
Right.
But then as part of that work, we interviewed a number of parents, spoke to a number of healthcare staff, and they gave us some really good ideas about how to improve the website, especially in terms of the visual nature of it, so it became to be more appealing to parents, and also the ability to navigate it and the ease of navigation. And so we had a big think. We were able to secure some funding to redesign the website, and then we came to Frank to discuss our thoughts.
Brilliant. And can you sort of share your experiences of that project and the delivery of the project?
Yeah, I mean, as you know, website redesign is challenging. It's complicated. I can compare our experiences the first time round with the ones just last year in the redesign. And the first time round, I don't think we had a particularly good idea as a project team about what we wanted. We were chopping and changing our ideas the whole time, and it was a really drawn out, difficult process, and I'm sure your web designers will say the same. It was really challenging. This time round we had a clearer idea, and also you made it clear to us that we had to have a vision that we could then work on.
Right.
And so Frank Design's use of your Excel template we found really helpful.
Great.
Because we put together a clearer plan of what we wanted the website to look like. And then we also had your experience with other websites to guide us to kind of make what we think are some really good decisions.
Brilliant. And could you talk through something that was a challenge within the project? I know early on in the project there was a lot of work that you did around scoping and going to meet parents and getting some feedback, and we pushed back the development because of that. How did you manage these types of challenges that came up in the project?
Yeah, I think the timelines are definitely one. When you have a client like us, we're keen to get something done quickly, and there's always the temptation to just rush something through.
Yeah.
And I think we, on this occasion, were much more mindful about getting some really meaningful feedback and data and having a clearer idea. And you guys were really patient with us.
Yeah.
Although you had some quite clear timeframes, you recognised that we were still collecting data and that we were better off doing it in a more time-sensible approach. I think the other bit was the vastness of our website. There were lots of bits for parents, bits for healthcare professionals, clinical pathways, all appearing and being redeveloped at different times. And I think, I'll reiterate, I think the Excel spreadsheet and the show and tells were really good. So I think that we had some ideas of what the website should look like. Your designers designed them.
Yeah.
But actually on a regular basis, you organise show and tells. And then when we saw it up in front of us, we realised that some of it looked great and actually some of it didn't. And it allowed us to then redesign or think about how we wanted things to look. The translate button was one where you developed a beautiful translate button, but we had no idea that it was one. So we saw some flags, put it there, and now it's much more obvious. So I think the show and tells are what were really impressive.
That's great to hear, because our head of operations, that's something he wanted to introduce. So nothing came out of the extraordinary during the project. You understand what you're seeing and from that.
Well, I think our experiences the first time round were that we didn't really see any of the design until it was done, and then we had issues.
Right.
And that's so time consuming for you guys and for us. And so this time, by addressing issues in real time, it was just a much more efficient and effective process.
Great.
Yeah.
And Sanjay, for people, we deal 20, 30, 40 types of these projects with the NHS every year, and what we see is people who approach these projects from the NHS, and they can be quite daunted by website projects, intranet projects, because they don't do them that often. What advice would you give to anybody watching this interview who's thinking about a public-facing website, an intranet, running that type of project within the NHS?
Yeah, I think the first thing is due diligence. Actually go and speak to the users. We put a lot of energy into conducting interviews with parents, and I think that time has been really well spent, because I think the output and the product really reflects what parents and young people want. And I know that, when we do head-to-head evaluations of what healthcare professionals think parents want and what parents want, it's so different. We just don't really know. Our assumptions about parental expectations are often so off the mark. So I would really advocate for that. I think another big thing is that there are other people who have done this. And so having a platform for sharing each other's experiences is really powerful.
Right.
This is all taxpayer money.
Yeah.
And I think that we have to be mindful about how we use that. And I'd be more than happy if someone dropped me an email if they were designing a children's website. Actually, I'd be really happy if someone wanted to take our whole website as a template and populate it with local information. And I think that's the real strength, that what I find most refreshing about Frank Design, that when we have designed things, we know that there would be the ability to share it with other NHS organisations, rather than reinventing the wheel, rather than spending vast amounts of money. An example is our SMS share function.
Yeah.
This was some feedback from GPs that they really wanted this function on the website and make it a lot easier for them to share safety netting and health literacy resources with parents. And so you source that. You source that from a software designer, and it's now on our website. But it also means that if another NHS organisation wants to use it, they're not going to have to pay the upfront costs that we paid.
Yeah, absolutely.
And I like the thought of that.
Yeah, absolutely. And I think that's what's behind a lot of the thinking of this Frank Talk, is to share knowledge, share experiences, and ultimately for us as an organisation is to share development within the NHS. So what's next for Wessex Healthier Together? Where's your thoughts, your plans? Obviously a website is ever evolving and changing, and your needs are. What's your thoughts for the next stage, Sanjay?
Yeah, I've had lots of thoughts. I think, for one, a website is great. Getting people to use the website is the real challenge. And so I think the energy one puts into developing a website, you need to put 10 times as much into implementation. And we've got a huge educational program involving education of GPs and primary healthcare staff, of hospital doctors, parental health literacy, and all of those are going to mean that the use of our website and the traffic is going to increase exponentially, I see, over the next few years.
Fantastic. Well, we wish you all the best with
Thank
that.
you.
Thank you very much for your time today.
Absolute pleasure.
Much appreciated. There is a conversation block that will be below this video, so please, if anybody has any comments with regards to the video, do share those, and either myself or even Sanjay might get an opportunity to respond. So thank you very much, and that's everything from us.